So I showed this yesterday in a video I did about these were the eugenics steps in mental development. And as you can see, these were actual terms they used in health. Idiot, low-grade imbecile, medium imbecile, yeah. But let's look a little closer at what this is really about. Because as you can see, the medium imbecile, well, they can do simple manual work. The high-grade imbecile, complex manual work. The moron, work requiring reason and judgment. Going down the steps the other way, you have the low-grade imbecile, can do simple menial work, and the idiot, self-preservation. So what is it all about? Well, it's very obvious. It's about labor. It's about what good are you? What can you do? Because you're only worth the work you can provide for the wealthiest people that, all form the World Economic Forum. The thing is, it's the CEOs in this country, most especially the ones that head up healthcare, that have been the most disgraceful and the most danger to health. The workplace is killing people and nobody cares. This was 2018. And it's true. And there was a CEO that actually stood up to another 1,000 CEOs and said it. Robert Chapman, CEO of Barry Willmiller, standing in front of 1,000 other CEOs and saying, "You are the cause of the healthcare crisis." Absolutely. They have been all along. They have been. I remember when I was younger, my dad, he had a cardiac disease, and he had a high-stress job. He was a dispatcher for a moving company, and his heart doctors kept telling him, out of Rush heart doctors were telling him, "You have got to get out of that job. It's going to kill you." Everybody knows about that stuff, right? You've heard it. You hear people say, "You get out of that job. It's not worth it." I currently work, I've said, in a place where I've said, I will walk. You are not going to put me in physically dangerous situations and expect me to stay. I will leave in the middle of the shift. I do not care. When you are going to continue to admit patients when we don't have the staff, then it's on you. It's on you. These CEOs have used our Constitution, these wealthy people have used our Constitution to advance themselves and then create the laws also that it protects them. Because really, as I've said, when it comes to healthcare, many of these CEOs, especially where I work, should be criminally gone after. When patients have been raped in your facilities, when staff has been raped in your facilities, when people have been so injured they can never work again in your facilities, and you continue to keep doing the same thing over and over again, and you never change and never put safety first, then there should be criminal charges against them. But they've created the laws, so all it is that you can do is go after them civilly. I mean, it's no sense going after OSHA. I contacted OSHA for the place I work at now. It's a waste of time, total waste of time. But this article goes on to say, there is a large amount of data that suggests the biggest source of stress is the workplace. Absolutely. Can anybody deny that? We've known this for years. We've known this for decades. But they always get away with it. So that's how Chapman can stand up and make the statement that CEOs are the cause of healthcare crisis. You are the source of stress. Stress causes chronic disease, and chronic disease is the biggest component of our ongoing and enormous healthcare costs. Job engagement, according to Gallup, is low. Distrust in management, according to the Edelman Trust Index, is high. Job satisfaction, according to the Conference Board, is low and has been in continual decline. The gig economy is growing, economic insecurity is growing, and wage growth overall is stagnant. I don't think there's anybody, at least in healthcare, you know that whatever you started, your pay that you started with the place you are at, you'll never go any higher than that. It's not like raises exist anymore. Fewer people are covered by employer-sponsored insurance than in the past. The focus on corporate sustainability that ignores the social damages. Yet this goes on to say how these CEOs then pride themselves on how they cut jobs. But the people that are left, the stress it causes on them. You know, in nursing, I'd say no nurse really gets, I mean, you don't, most nurses know wherever you work, it's like getting a 30-minute break is like unreal. Like most of your nurse profession, it's like, what, a 30-minute break? Are you kidding? But technically you should get one, right? So what's interesting is, as bad as the place is where I work, for whatever reason, they get freaked out if everybody doesn't take the 30 minutes, okay? I mean, I think it has something to do with they have that agreement with the federal government, the corporate integrity thing. Yeah, it's nonsense, but I think it has something to do with that. So they make the supervisors come and break you. So recently we get a 30-minute break. But in a 12-hour shift, you're supposed to get 30 minutes and two 15-minute breaks or two 10-minute breaks. It used to be two 15 minutes. It depends on where you look, okay? Okay, so that's never going to happen. Yet I take an extra 6 minutes on my lunch, okay? And they get all upset about it. The supervisor's like, you know, you're 6 minutes late. It's like, did you come over here to break me? The other 2 times I should have been broken, like I've been given a break. But nobody, didn't say this. That's all I could think, though, is really. Because part of the problem is everybody goes along with it. We all become useful idiots. So then what the CEOs do is, no, they'll tolerate it because they need the paycheck. So we're all part of the problem in it, okay? Because technically, if you want to make a big deal that somebody takes an extra 6 minutes on their lunch, it's like, okay, you should have been, when I'm the only nurse on a unit, and technically I should also get 2 breaks. You weren't over here breaking me for those 2 breaks, though, were you? No, because they short staff you so much, they do nothing but want to cause mental and physical crisis on people. That's what the CEOs are doing. Then what do the CEOs do? They go and they form the World Economic Forum, and they think they're the best people to know how best to control the population or what should be done in society. No, what you people have done, you are responsible for the slave system we all work under. I get that we play an important component. You'll always have useful idiots that'll go along. But something needs to be done. Like, nurses used to love what they do, but they've taken so much independence away from nurses. Like, it used to be you're a part of a team, but you don't have one when you have no staff. But there's too many useful idiots that go along with the system. And you make clear that the yoga classes and nap rooms won't fix this. What are some of the ways this culture might change? Yeah, they come up with all these ideas, okay? Like nursing does this too. This will help people. No, if you really want to help people, provide staff. For nursing, that's what you need. So when American Nurses Association has been in charge of nursing forever, and the nursing unions, and yet there is still nothing but a continual worsening staff shortage, then what you should realize is the very people setting the standard of care for your profession are incompetent, because for decades your staffing situation has only gotten worse. So they're either doing it on purpose, as I've said they are, because they're in with the hospital and they want people to quit. They want people to quit. They want to drive you out because they want to bring in cheap labor, because they know, well, we got to keep the hospital open. So they'll do whatever they have to. So they don't. That's why they don't want American nurses in working in America. They want the cheap labor. The unions, American Nurses Association, are in bed. The people at the tops of those organizations serving the very hospital CEOs that, in my opinion, many are criminally liable for the abuse they've done to their staff. Because this is slave labor in some cases, depending on where you work. And they have done this forever, and it's gotten worse. So when it's gotten worse, then that's why we have a worse mental health crisis, a worse disease crisis, a worse virus crisis, a worse everything. Because the very same people, the CEOs that have been controlling everything and have been gaining the most for themselves and their pockets, have been doing it based on the slave labor.